Let's get started. If I was a mayor, I'd have a gavel for this raucous group. But good morning, everybody. We're going to convene the Shawnee County Board of Health meeting for July 7th, 2014. And just as introduction, my name is Bob Archer, and I am the chair for the Board of Commissioners, and I also serve as the chair for this meeting. I represent District 3 in the commission. To my right is Commissioner Kevin Cook, who serves as vice chair of the commission and represents District 2. And to my left is Commissioner Shelley Bueller, who represents District 1.
Member.
That's right. And I look forward to my being a member again next year, actually. So I did want to welcome everyone this morning. And together, the three of us serve as the Board of Health for Shawnee County. To give you a preview of what we're going to be talking about today, some of the topics are, number one, the progress of the Community Health Improvement Plan, which is very, very important. Our immunization program, which includes school and child care immunization requirements. Third, reportable disease requirements in Kansas. And then finally, updates on special projects. And before we've got a busy agenda, we've got a lot to cover, but before we do, I want to acknowledge some special guests in attendance. Number one, members of Heartland Healthy Neighborhoods leadership team. Want to raise your hand? Okay, good. And then the co-chairs of the Community Health Improvement Planning Committee are here too. So, welcome. Welcome. Thank you for taking time out of your schedule for this very important meeting. It is very important to our community. We're being streamed live on the Shawnee County website, and we're also being recorded, and from what I understand, will be available on the website for people to look at a later date. And the good thing about this meeting is there'll be an opportunity for questions and answers and public comments later as we go. So having given all the ground rules and introductions and thanks, I'm going to turn it over to Allison Alejos to get us started.
Thank you. Good morning, all. As Commissioner Archer indicated, we have some very special guests in the audience, but we also have folks from the management team, and I'd like to acknowledge their presence today, and you'll be hearing from some of those as we move forward. We also have the Shawnee County Health Officer here, Dr. John Franco Pizzino, so we're pleased to have him with us as well. So that being said, today we do have a very busy agenda, and we are going to be talking about one of the first things we're going to discuss is the Community Health Improvement Plan and kind of what our status is of that. As you all know, we've got a lot of people that are coming to the table on a monthly basis to talk about things that we can do in our community to improve the health. Just as a reminder, we have 4 primary areas that we're working in. We've got the Healthy Babies Committee, we've got a Healthy Eating Active Living Committee. We also have a committee that's focused on access to care only as it relates to transportation and knowledge of healthcare services. Currently, we also, as you all know, have a Safety Net Summit that's looking at broader issues related to access, but within the Community Health Improvement Plan, this is where our focus is. And then we're also working on Complete Streets, which really ties in very nicely to all of the activities we've got going on. Okay, so talking about Healthy Babies, I'm just going to do a very quick update on where we're at with each group. They have been spending starting in June, they have a meeting that's dedicated to very specific topics. So June, the people that came to the meeting were really talking about breastfeeding issues, working to find what are the different best practices that are going on in our community, what kind of resources do we have at our hands that we're not maybe all aware of, but we want to identify those. We're also, in July, they're looking at prenatal care, so that's at our next meeting, they'll be spending a lot of time looking at prenatal care because that's a very important consideration when it comes to having healthy babies. And then August, they're going to be looking at some unidentified infant death and trying to get those experts at the table that really can give them some knowledge and expertise in the work that they're trying to move forward. As you can see, the last bullet point on this slide is they continue to work at having people at the table, and I know that that's something that you'll hear universally throughout the different work groups. We do have a variety of people, but obviously as we work very hard to make progress on this plan, there are going to be additional people that need to participate that may not be at the table right now, but we continue to try to get folks there that need to be there. Healthy eating and active living. This group has been very busy, and they had a very broad range of topics. They are really spending a lot of time looking at really healthy eating in one category, and then also the physical activity. And so they've got lots and lots of people that come to the meeting, but they still continue to try to get more and more involvement. Access. The focus that they're working on within this committee is they're really looking at trying to have a resource that's available for providers, our medical physicians, nurse practitioners, physician assistants, a directory of sort that they can use with their patients. When we look back at the focus group and what the community felt to be the biggest need is those providers really weren't sure where to direct patients on some topics, particularly as it relates to transportation and also knowledge of other services. There are multiple resource directories out there, and they are trying to figure out how to make that more usable and maybe a more consistent or single area that folks can go to. So they've got a very big task, and it's kind of different than some of the others because it doesn't have evidence-based programs or best practices as you might see in some of the other areas. Complete Streets. We've been working really hard. This is one of the committees that I co-chair along with Tara Dimmick and Emma Starkey. And we have been working to develop a policy that can be implemented in the county and the city. And so what we've done is we've taken the best Complete Streets policies of 2013 along with Complete Streets local policy workbook to design what we believe will be a very effective policy for our community. We will be working this month with the Public Health Law Center to really explore the draft policy that's been put together and see if there's any adjustments or things that we need to consider as we try to move this forward and out of our work groups.
Good. Would you tell us a little bit about Complete Streets? I don't know that the public is all that familiar
Sure,
with them
sure.
and how it would impact the health of our community.
Complete Streets really looks at having effective modes of transportation for all users. So whether it's somebody that's walking, whether it's somebody that's using a bike, a car, or transportation with a public bus system, it's looking at ways to make the transportation effective in our community. We look for places to be able to walk, a destination. So maybe getting to the grocery store so that people can buy healthy foods, getting those children out there riding bikes in a safe environment, all kinds of things really that ultimately tie back to the health of our community. So it's a really good and exciting time to be involved in this work, and we'll see more and more of that across the U.S.
Allison, could I just add too?
Sure.
I think oftentimes it ties into the infrastructure and the sidewalks and the streets and the size of the streets and, like you said, all those modes of transportation that are utilizing that. So it often ties back to infrastructure and design as well.
Absolutely.
And this is a relatively new concept, I think, isn't it? I just
No.
heard about it when I was on city council a few years ago, and I'd never heard the subject matter and the topic presented the way it was at that time.
I think the movement has been going on for a little bit of time, but it's starting to finally gain some
Oh, okay.
momentum.
Okay.
I know that, again, if you look at some of the policies that are being designed for other communities, I mean, there's a lot that we can look at and learn from. Again, it really helps develop a community that people want to live in, that want to be here. It speaks to all of us.
Good. Thank you, Al.
Okay, so just some other news, just some neat things that we've done through our work with Heartland Healthy Neighborhoods. Again, I just want to emphasize we do meet monthly, so if anybody's interested, they're more than welcome to attend. We encourage the public to attend as well. We meet at the Avondale East Net Center, which is on 455 Southeast Golf Park Boulevard. We meet the second Monday of each month from 11:45 to 1. And again, we have a lot of people coming. It's a very exciting place and meeting to be at. We actually have participated in the Capital City Campout. That was a event that happened at the Governor's Mansion. There were 4 cities across the U.S. that were selected to participate with this Capital City Campout. We were able to go, and you can see us lined up. We were distributing snacks to the different campers, and I believe there were around 80 campers and 40 adults that were there with those campers. And we gave them a nutritious snack, and if you notice here on the lid of this container, we had different messages, health-related messages that were there as well. So it was a great way for us to get out there, talk to people about what it is that we're doing and why we're doing it, and encourage folks to participate if they're interested. So it was a lot of fun. Again, we continue to look at trying to get additional members to the table. We are seeing some interesting changes in the work that goes on at Heartland Healthy Neighborhoods. Not only are we working on the health improvement planning, but we have additional people coming to us wanting us to help them lead their charge or participate in activities, healthful activities that could benefit the community. Capital City Campout's an example of that. We have also been approached by the American Lung Association to work on possibly being the coalition that supports smoke-free housing or developing some initiative towards that end. Just some really neat things that are happening to crop up. I'm going to share some information about a food policy council during this presentation, which was another thing that showed up through this work at Heartland Healthy Neighborhoods. So lots of neat things are happening here. And just as a point of reference in your handouts that were distributed, you'll see as a reminder, there is the brightly colored sheet. That is the goals and objectives that have been listed for each one of those committees. So just to serve as a reminder of the work that we've been looking at. Oops, no, wrong way. Okay, now Linda Oakes, our division manager for family services, is going to come up and she's going to speak to us about the immunization program.
Good morning.
Good morning.
As Allison said, I'm Linda Oakes, and I'm the division manager for immunization and the WIC program. Here you have a very typical, I think, client getting a shot in our immunization program. Actually, that's probably more typical of what we see. So in our clinic, we do immunizations for infants, we do children, adults, we do travel, so I'm just going to hit on these just very briefly for you. This is actually the recommendation schedule for children 0 to 18 years, and you can see it's pretty complicated. There's also 3 pages of footnotes. They look like this. You have to have your glasses on to see them. And this is the book that our nurses use this is called the Pink Book. It's the Epidemiology and Prevention of Vaccine-Preventable Diseases. It's also online, but we usually get one hard copy in case the internet's down and we need it. So they are they're very highly trained. It's very complicated to figure out what shots are needed and when they're needed. Just to give you an example, I wanted to quickly read one footnote about one shot. And this is about the diphtheria and tetanus toxoid and acellular pertussis vaccine, or as we like to call it, the DTaP. The minimum age is 6 weeks, but the exception is the Kinrix, which is a combination shot between the DTaP and polio, and that's given at 4 years. So routine vaccination is that you administer a 5-dose series of DTaP vaccine at ages 2, 4, 6, 15 through 18 months, and 4 to 6 years. So that's where you're seeing the lines. The 4th dose may be administered as early as 12 months, provided at least 6 months have elapsed since the 3rd dose. Catch-up vaccination, the 5th dose of DTaP vaccine, is not necessary if the 4th dose was administered at ages 4 years or older. For other catch-up guidance, see Figure 2. So you can see it's very complicated, and they have to know what they're doing, so they get a lot of training in this area. We do travel vaccines. We get a lot of travelers from around the region. We are one of the few health departments that do all the travel vaccine. And so the immunization staff members do a lot of research to determine which vaccines are needed. And we are a certified yellow fever vaccine center. This is the yellow fever little book. When you travel, all travelers have to show proof of yellow fever vaccination before they can enter certain countries. And some countries provide proof of vaccine only if travelers have been in a risk area. So if travelers are traveling to different countries and they don't have this, they may get stuck at the border. So very important that they get that and have it. Here's just a few little statistics about our immunization program. In 2013, we had over 6,000 people receive about 17,800 vaccinations. But I also put up July 1st to October 31st. This is our very busy time of the year. We call this our back-to-school time. So people start coming in around the 1st of July to get those back-to-school shots. And it goes pretty much through the end of October, because that is when the schools start sending the notices that you need to get these vaccines or you can't come back to school. And so we see about a half of our patients in this 4-month period. And so far this year, this is the number we've given, about 7,000 vaccinations this year. You have the school schedule in your packet. Again, this is put out by Kansas Department of Health and Environment, and these are the requirements for school. Let's see. These requirements are, they have them so that children stay healthy. What happens, and I think you've heard the reports like of the measles outbreaks, so if we have children that aren't vaccinated, then these diseases start cropping up again. And it had been years since we'd seen measles, and now we're seeing it again. And the danger is that some people can't get vaccines. They have maybe health conditions that prevent them from being able to be vaccinated, so they are very high risk. So we really want everyone to be vaccinated. If you do not have your vaccine, say you don't have your chickenpox vaccine, and we have a case in school, a child could be excluded from school up to 21 days after the last confirmation. So it's a long time they could be out of school. And this is the end of the recommendations for school. And then these are the recommendations for licensed child care facilities and early childhood programs. So, and they're the younger children. These are the ones, and again, they're in your packet if you're interested in reading them.
Linda, can I ask you a question?
Sure.
So those are for public schools or all schools?
All schools.
Public
Yeah,
and private?
That's correct, right? All schools, public and private, yes.
Thank you.
So my message to everyone is if you need school immunizations, come in now. We're not super busy yet, but the lines are going to start getting long and the wait time is going to get longer. We do some special things to gear up for right before school. We have folks wait in the auditorium. We have extra help from around the department. But that day before school starts, it's a wait. So I really encourage folks to get in now and get those school vaccines. It's a walk-in clinic. These are our hours. And if you have any questions, feel free to call us, and one of the nurses or staff members will help you. And do you have any questions for me today?
Commissioner?
Cost for immunizations.
Yeah, we have different vaccines. It's kind of complicated. I'll try to make it simple. There's some vaccine that we get from the state that's federally funded and some vaccine that's state funded. Those are for children that don't have insurance or they have CanCare Health Wave insurance. And so that's called the Vaccine for Children program. Those vaccines are free. There is a small administrative fee that we charge, and that we can work things out with them. If they have insurance like Blue Cross, for adults, we have private vaccine that we buy through the private market, and that we give those pretty close to cost. So, and there's different prices for the different vaccines.
But there's no excuse for a
Right.
parent not to have their kid vaccinated.
We'll work
And
with
that
them.
irritates me when I hear people that don't. I mean, I know there were rumors several years ago about it causes autism and all this. There's really no reason whatsoever not to have your kids vaccinated. Is that right?
That's right. There's lots of studies that disprove that about
Okay.
the autism. There was
Okay.
the one false study that the doctor has since lost his license. That was a fraud thing against the pharmaceutical companies, so that has been disproven.
Okay.
Yeah.
So I think that the word needs to get out on that. Like I say,
Our vaccines
I
are
just get
safe.
irritated. Okay.
And
Yeah,
I
they're
just
good.
have
Oh,
one
go
more
ahead,
question.
Commissioner.
Linda, so if you're a parent and you know that your child's received some vaccinations, so how's that tracked? I mean, you know, it's the pink cards, are those still standard? And, okay, say you may go to the health agency 1 year and then you go to your local doctor, your primary care physician, one other. So how is that tracked through the state?
We actually have a state immunization registry called WebIZ,
Okay.
and all the health departments and many, many private doctors are now on that system, and so we can track those across the state. And we tell folks when they come in from out of state, bring your records in and we'll put them in the system and then you'll have them. So college-age kids, it's not been around that long, so that's a little tougher.
Yeah.
So we encourage
Yeah.
them to bring those records in, we'll get them in the system, and then we'll have them forever, and they can access them anytime.
Good, thank you.
Any more questions?
Very good. No,
Thank you so
very
much.
much. Very informative. I
Thank you.
appreciate it.
Which papers are mine?
Now we're going to have Ed Kalis, who is our Division Manager for Environmental and Community Health, come up and talk to you all about the Communicable Disease Program.
Good morning, Commissioners. Our division is called Environmental and Community Health, and that will include environmental health, child care licensing, emergency preparedness, and then communicable diseases. And the first of the 4 topics that I'll cover today are communicable diseases. In front of you, you have a list of the reportable diseases that the state requires that medical personnel report to them or the local health department for investigations to be started. Communicable disease is one of the programs in the health department that is statutorily required through the authority of the Board of Health and through the work of the health officer and the health department. And these are mainly the diseases and conditions that we look at. In our area, we have one team that's basically the CD team, and I believe I mentioned before where they do different things, but they concentrate on communicable disease investigation, STDs, and tuberculosis. In that group, we have one team leader and 3 nurses, and we also have backup nurses to do CD investigations when they get larger through the immunizations. So those 57 diseases or conditions up there are actually the ones that we work with the most, and we work with KDHC to do this through their system called EpiTrax. It's an electronic surveillance system. The ones up there in red require reporting within 4 hours. Those are really, really important for us to know as quickly as possible. The other ones are in 7 days. Now, currently, they're working on some revisions through regulation to reduce that down to 24 hours, because getting somebody to wait 7 days to report a case of measles is not a really good plan. We do investigate all cases that we get. Cases are classified 4 different ways, depending on what the disease is. There is a confirmed case, which there's really no question that that is what we're talking about. A probable, which means that's a little less confirmed. A suspect, and then a not a case. When we get a case in, we don't know that it's not a case until we do a full investigation. So we do the work, or those folks do the work, whether or not it winds up being confirmed or not. So there's a lot of work going on in this program. Also, a lot of worry about HIPAA, because we have a little bit looser version of HIPAA trying to prevent these diseases from being spread. But we still need to keep in mind that these are individuals with their own personal health information, and we need to be as transparent as we can, but also consider the HIPAA factor. We do get a lot of these cases. We're getting more and more of different types of cases. We've had a mosquito-borne disease. Okay, we don't know. I should have just spelled it out for
How
you.
to pronounce it, I know.
I don't even know why I brought it up, because I knew I wasn't going to be able to say it. So but there are other things. These diseases are changed occasionally by state, and a lot of them are because they're communicable or they're new diseases that are coming up, so they may change what's reportable. A case of a couple of diseases that we've had that wound up not being cases over the last 3 weeks. We've had a measles case and a mumps case, and we had to go full speed to make sure that those weren't those things. But it still required the work, even though in the end we wound up finding out that they weren't even those diseases. So there's a lot of work that the staff that does this program goes through.
Hey,
Yes.
would you mention your work with the health officer with those investigations?
Yes. We meet every couple of weeks or more with Dr. Pizzino, the team leader for the disease control staff, and we talk about all of the different diseases we work with, TB, mostly the communicable disease cases, and we are in constant contact with Dr. Pizzino to get the medical and the epidemiological overview to him and then get his expertise back so we know through his guidance what we can do. The next topic is rabies. Now, rabies, a lot of people, they know what it is. They know it's a bad thing. They may or may not recognize that it's fatal if it's spread to somebody and that person doesn't know it, or there's no way, they don't do what they need to do after they've been bitten by a rabid animal. Rabies is a disease that is basically transmitted through warm-blooded animals. Most of what we worry about in our area would be raccoons, skunks, and bats. We have had rabbit cats in Shawnee County before. There's a lot of concern on our end at our department about animals that are not being vaccinated for rabies. That is a major concern for us. We've had a couple cases in the last month or so to where there have been lots of confrontation about what people should be doing with those animals that have been attacked by, let's say, a coyote. And what are the responsibilities of the health department to protect the public from potential rabies through those bites from those animals. So one of the questions that we kind of came up with today, that just to get out information, is if your dog is bitten by a coyote and is not current on its rabies vaccine, how long will you have to quarantine it? And quarantine either could be in a veterinary hospital or, depending on the situation, might be at your house. So anybody want to guess? The people who know do not answer. Okay. Okay. So we'll just go through the different choices you have. The first one's 10 days. Now, a 10-day quarantine is for an animal that bit a human. Within 10 days, we should know, based on the reaction of that animal, whether or not it had rabies. And if it clears quarantine, then it's fine to go. We recommend that if they didn't get a shot, that they get the shot. Otherwise, we're good. And if the person that was bitten does not start treatment, we recommend not to bother. Or if they had started it, we potentially could recommend to stop the treatment. So 10 days was what most people know about when they hear about rabies quarantine. The next one's 45 days. Well, that 45 days is not actually a quarantine. That's for an animal bitten by, let's say, a coyote that is fully vaccinated. So what we will do is we'll observe that animal. They don't have to be quarantined. They can go about their daily business. But after 45 days, we'll verify that nothing strange happened, the animal's in good condition, and move on. The 60 days was just a filler because four answers was a good number of answers. 6 months. If you have an animal that is bitten by a potentially rabid animal, whether it's a wild animal, another dog that you're not sure has had its shots or not, 6 months is how long you will have to keep that animal in quarantine. We have a case that we're kind of working on now where that has happened. Typically, we don't have to worry about it because at some point, based on the expense of either the vet or the wanting to avoid contact with the family of the dogs are usually put down. But 6 months is a very long time, and depending on the situation, if we require it to be at a vet, we're talking thousands of dollars. So the bottom line recommendation for rabies is get the dog their shots. Make sure that they stay current, and then at the very worst, if your dog or cat is bitten by something that might be rabid, we're looking at a 45-day observation, which means we're just going to pay attention to what's going on, but we don't have to keep that animal separate from other humans or animals. Next topic is blue-green algae. Now, you might have heard of this before in Shawnee County. Blue-green algae is basically a bacteria that produces a toxin when the growth conditions are right. The toxin can be toxic to both animals and people. There is a warning advisory system that the state puts out for bodies of water that are tested and shown to potentially have blue-green algae toxicity. It's kind of like the weather warning. You have a watch and you have a warning. For an advisory, that basically means the conditions are right. The temperature is high enough, there's enough nitrogen and phosphate in the water to allow the bacteria to grow, but the levels of toxin have not gotten bad enough to be an issue. The next one is a warning, and basically that is like your tornado warning. It's here. The conditions were right. The conditions are there. You keep your dog out of the pond. You don't eat the fish any more than you have to. If you're going to eat it, just eat the fillet part. Get rid of all of the innards and all of the other parts, and stay out of the water until the conditions have changed. One thing a lot of people they misunderstand is that there might be a warning at a place, and then all of a sudden the water starts looking clear. Just because the water is clear doesn't mean the toxin is gone. So until the warning is lifted, which you should see some kind of a sign, till the warning is lifted, people should follow what the requirements of the warning is. So bottom line is, if that's there, try not to eat the fish and basically keep your animals and stay out of the water. We have had bodies of water in Shawnee County have warnings. For about 3 years, the pond at Central Park had warnings, and then last year for the first time, Lake Shawnee had warnings, and at this point, we have not had anything in Shawnee County come back up on the list. And then the last area for this time of year is mosquito-borne illness. There are a lot of mosquito-borne illnesses that you've heard about before, West Nile virus, St. Louis encephalitis, a lot of them. Basically, if you don't get bitten, then you don't have a way to have the disease transmitted from the mosquito back to you. So again, we reiterate the requirements for not getting bitten, or some of the advice, which would be at dawn and dusk, wear clothing that's either long sleeve or long pants to cover all of your exposed skin. Eliminate standing water. Mosquitoes have to have so much time in the water for their eggs to hatch and grow and reproduce. And then the last one is use DEET, and I believe it's under 10% DEET for especially children. But those are three of the techniques that you can use. There are a lot of other ones, and you can find on our webpage or on KDHE's webpage. But mosquitoes are around. It's the time of year. If you don't mow your grass very often, if you don't get rid of the sources of water, they're gonna bother you. And some of them are gonna have disease and some aren't. But you don't know which ones they are, so you need to protect yourself. Anybody have any questions?
Questions for Ed?
No, very informative.
Commissioner Green?
Ed, what is, I'm trying to search, what is that most recent mosquito-borne illness? Doctor, can you help? I just heard it coming in.
Impossible to pronounce.
Yeah, it's from the Caribbean.
Something like that.
It's from the
But
Caribbean.
Essentially, it's as I was saying, it's a mosquito-borne virus that is not present in the United States. It's just in some countries, mostly in the Caribbean. It's very similar to another disease that people have known for a longer time, which is dengue fever.
Okay.
They're usually not fatal, although some people may die from that. But they make people quite sick. It's
Yeah.
quite miserable. It's a lot of muscle pain, joint pains, fever, and fatigue for weeks and weeks and weeks. And the concern is that the mosquitoes that can carry the virus are indeed present in the United States, even though the virus is not. So if people come back with the virus in a high enough number, those mosquitoes may be able to start transmitting the virus from person to person, and the disease may be established also in the United States.
Thanks.
Okay, thank you, Ed.
Okay, now we're going to talk a little bit about special projects, and I'm going to just talk briefly about the Fetal Infant Mortality Review Program. This is actually a grant-funded program that we received from the Kansas Health Foundation and the United Methodist Health Ministry Fund. Kansas Action for Children is serving as a fiscal agent, but we've got 5 years of funding to do this work, and we are now currently in year 2 of that funding. The grant will decrease beginning next year. It will start to go down 25% until ultimately we're not receiving any dollars to do this work. But as a reminder, really what we're trying to do with a fetal infant mortality review is look at infant mortality in depth within Shawnee County and try to identify any trends that we may have that we can then do further follow-up and action within the community through whether it be policy change or just getting physicians maybe to do something a little bit different, increasing awareness and knowledge for our pregnant women, young families. Anyhow, so some of the things that we want to do at this point, we need to get a project coordinator hired. We need to be doing medical record abstractions, and that's really where our one of our registered nurses will go out and look in depth at the medical record of the individuals that have had an infant death. We'll do maternal interviews for those women that are willing to participate in that, to talk to them in depth about their experience through pregnancy and delivery and ultimately the infant's death. And then we'll be working with getting that information compiled and bringing it back to what's called a community review team. And that's going to be your physicians, social workers, other providers in the community that understand the medical aspects of pregnancy and delivery and can really look at in depth what has been found thus far. They then will put together recommendations that will then move out into a community action team. This is not a quick process. It takes probably 1 to 2 years before we get enough data to really make any recommendations. So it's a very long-term investment by us in our community.
Was it- Oh, I'm sorry. Go ahead.
No, go ahead.
Well, I was going to say, wasn't there some controversy recently about access to information? Is that,
I think
What's-
I think that has all been resolved. I
Is-
think
okay.
as far as what we're doing here within our project, we have to do what's called we have to receive IRB approval, so Institutional Review Board approval.
okay,
And so we go through some very strict training to teach us about how to interact with the families that we're working with. They're human subjects in essence. It's a
Right.
research project. And we need to make sure that we're following the guidelines and policies that have been established and approved by that board. Any changes in staffing, any changes in policies have to then be approved again by that board. So we are very,
so we've taken the necessary steps, I
have.
guess I think that's important.
Commissioner, I think what you're referring to is the Kansas Child Death Review
Right.
and the confidentiality provisions in the legislature took to address that.
which is different than what we're doing.
Okay,
So just to give you an update on some of the work that's happened, our first year was very, very busy in trying to get the infrastructure developed for the FEMA project. A lot of policy development, a lot of technical assistance and training that we had by staff. It took us a very long time to get a project coordinator hired. and she did not last long. She went to another position, so we are now without a project coordinator again. What we have done is we've put together a revised budget and plan and have submitted it to our funders for their consideration. The plan that we have submitted is actually would allow us to do a contract with a consultant that could help us make sure we get the remaining infrastructure needs met, that could get out there and teach us how to do these community review teams. Somebody that's got experience, and we've been talking, we're in those talks right now, but we're still waiting to hear back from the funders as to whether that would be an approved change. We'll then be also contracting with registered nurses at the hospitals is our hope, and they would do the record abstractions and ultimately train our own nurses within our maternal and child health outreach programs to do those record abstractions. We've got social work staff that can also assist with the maternal interviews. And so all of that's kind of wrapped up in the revised plan. I can tell you if we do not get some further progress with getting some of these actions taken, we do risk losing the funding because we're not following the timeline and the grant deliverables that were laid out. We continue to do the work, have been doing the work very hard over the last year and a half, but we hope that we can get an approved revision to our plan and then continue working forward. A really good positive thing that's happened for us is we have been able to get Dr. Dennis Cooley to agree to serve as the chair for our community review team. He serves on the Kansas Blue Ribbon panel for infant mortality and is just a huge advocate for trying to make sure people have healthy babies. So we're very fortunate to have him. He and I are scheduled to provide a training to the pediatric physicians and practitioners in August. It'll be almost a 3-hour training that we'll be delivering to them, and we're very excited about that opportunity, and I think there'll be some additional things that come up as a result of that. I think there's going to be a lot of interest as people start hearing about FEMA and what that can mean for making sure we have healthy babies in our community. If you have any questions for FEMA, I'm happy to answer them now before I let Misty talk about safe routes to school.
Commissioners?
No, I'm fine, thank you.
Okay, thank you.
Good morning. This is really exciting because this is the work that we're doing that relates back to the work that's going on at HHN and through some of the work that's going on there. So as you know, we were granted a Safe Routes to School grant through the Topeka Metropolitan Planning Organization. And so with that, we were awarded $10,025 from them, which is going to fund 15% of a position already on staff, our health promotions coordinator. And this person will be doing the work of the Safe Routes grant. There was a 20% match for the county, so it was $2,506, which is met through current tax allocation in the health agency's budget to help supplement some of his additional salary. We are looking at a 2-mile radius of Quincy Elementary. And so we approached Topeka Public Schools and said, hey, we have this opportunity. Would you be interested? Is there a school you're looking at? And they actually suggested to us Quincy, and that's how this came about. And so we have been already working with them, but we're looking at a 2-mile radius of the school, and specifically the parents had some issues that they wanted us to look at, as well as the school itself had some specific areas that we'll be looking at. So we're really looking at why kids don't bike or ride to school and how we can work to improve that in the area. So things like sidewalks, lack of sidewalks, abandoned houses, stray dogs, anything that would prevent a kid from riding or biking to school. That's what we're looking at with this. Some of the goals are to engage the parents of the school, to survey the students, to complete a walking assessment of the area, to engage community and neighborhood organizations, and to work to, the ultimate goal is to create a neighborhood plan. So what's happened so far, we have met with the PTO at Quincy and actually got some really good feedback from the parents with that, things that they see that prevents them personally from letting their kids ride or bike to school. We have conducted student surveys, and so the teachers basically took 3 days out of a week and asked the kids how they got to and from school for the day. And so we didn't get great results. We're going to do it again when school gets back in session, but we want to see how they're getting to school. Are they getting dropped off? Are they riding the bus? What is the current method for them? And then we have our walking assessment scheduled for August, which will basically hopefully be about 20 volunteers out and about in the neighborhoods, really walking as the kids would, to see what things they see. There's a major crack in the sidewalk, or there isn't sidewalks on this particular street. The school is very interested in the area in Noto, as that's part of their emergency evacuation route for the school. But they also do a lot of partnerships with Noto in regards to students having art classes over there and after-school programs. So that's one area that we'll be focusing on. The parents were very concerned about the area directly around the school, and so we will have a high focus area of that area as well. And so those are some of the things that have started and will continue as we work through this over the next year. And then ultimately we will create a plan for the neighborhood and for the school that hopefully they can turn around and apply for additional funding to do infrastructure changes, whether it's creating new crosswalks, looking at traffic signals, putting signage up to direct the kids which way they should be walking or which streets to take. So ultimately we'll create a plan for them, with them, and hopefully they'll be able to move forward with some infrastructure changes. The next thing I just wanted to update you on was a Fit Fresh Fund grant that we were just awarded through the Kansas Health Foundation. It was $9,500. With this grant, we will be doing some great partnerships with the Wellness Information Network, which is also called Making Moves, with the K-State Research and Extension Office, as well as the Health Agency. So this is really a three-layer approach here. So we're going to be looking at physical fitness with Making Moves and the Wellness Information Network. We'll be looking at free cooking classes that will be done through K-State Extension Office, as well as the Health Agency's WIC program. And then we will be looking at establishing a farmer's market in East or Central Topeka. So with the Making Moves program, they already are providing free fitness classes several days out of the week that are open to anyone and everyone. And so what we want to do is we have secured some funding to help them get some fitness equipment. And so that will allow them to do different things within their classes and hopefully reach more people, as they have some equipment, but as they expand, they won't be able to continue to do some of that stuff. None of the equipment has actually been purchased to date, but has been priced out, and we're looking to move forward with some of that.
Can I ask you a question?
Yes.
You say you're going to establish a farmer's market. We already have one.
We
went there Saturday morning, as a matter
We
of
have
fact.
several in Shawnee
Okay.
County. Unfortunately, we don't have in the east area of Shawnee County. So when you think of like Avondale East and Net Reach area, we don't have farmers markets. And part of that area is actually in a food desert. And so those folks who live there do not have access to healthy fruits and vegetables. Maybe through a gas station, if they're lucky, they might have some apples, oranges. And so the goal is to help provide access to those folks who live in those areas, who tend to be low income, low socioeconomic, and maybe don't have cars to drive to the grocery store. And so we're looking at locations right now to try to figure out the best spot to address a food desert issue, but also make sure we're reaching the most amount of people that we could reach by whatever location that farmer's market is established in.
How do you make a site attractive for farmers to come in and sell their produce? I guess I never thought about that until you mentioned it.
Well, that will be part of the work that we're doing. This grant just started July 1,
Oh,
so we
okay.
haven't got into that yet. But one of the things that we'll really have to look at is the farmers aren't going to want to come if people aren't coming there and
Right.
spending money. I mean, it's got to be profitable for
Yeah.
them. And so that will be part of the work that we're doing. That also plays into the Food Policy Council that Allison's going to talk about in a little bit too. But that's all part of figuring this out and making sure that we get the vendors there and that we get the people to come and actually purchase there. So hopefully it'll all work out, but we'll see.
Thank you, Misty.
You're welcome. The second part of this grant is the cooking classes. So K-State Extension Office already offers free cooking classes for families. They are four-week classes that they come once a week. They cook dinner together. They sit and actually eat what they cook. They talk to them about how to grocery shop on a budget, how to pick healthy foods at the grocery store, and how to prepare the food in a healthy way. And so we will be partnering with them. They'll be actually teaching our WIC staff their process and how they do their program, and then we will be able to offer those classes as well. And so part of it will be they'll do a 1 4-week session, and then we'll take on a 4-week session. They'll take on a 4-week, we'll take on a 4-week. The classes are free. They're open to anyone who wants to come. There is a limit just because we can only get so many people in the room to cook. So the money from this grant will be used to actually purchase the food for the people to cook. It'll be used if we need to rent a space or anything like that. But the really exciting part of K-State's class is that the kids can actually cook with the parents if they're old enough. If they're not, they offer free childcare for them. So that will be a piece that we have to figure out as a health agency how we're going to accommodate that. But it's really important as that part of the cooking class that they have that ability, especially as we're talking our WIC families and making sure that they can come, but they also have an option for their kids. And then the last part is the farmers market and the food desert. And so that will be some work that will be starting here pretty quick. So what's already happened, we've had our, a meeting with all the partners. We kind of have a semi-plan put together of how to move forward at this point. Again, we've priced some of the fitness equipment but haven't actually purchased. We're working on getting that staff training established for the cooking classes to make sure our staff understands and gets questions answered so that we can just follow the same format K-State's already doing. And then we still need to find a location for the health agency cooking classes as well as the farmers market location. So with that, I would be happy to answer any questions that you might have.
Other questions for Misty?
As you move forward with the programs, I mean, how are you going to be getting the media out? How are you going to be letting people know about the opportunities?
There was some dollars built into this grant for promotion, and so it will have to promote all pieces of this. Some of this is already going and established, which is great. So the fitness classes, they're already going, and she actually has a wonderful following at this point. So we can utilize some of that to build the momentum. Obviously, we have some resources within the county to connect with local media and hopefully let them help get some of that out. Some of it will be direct contact with our patients and just letting, you know, as people come in for their WIC appointment, letting them know these different things. I think the farmers market is probably going to be the hardest part in getting that information out and getting people to excited, and it may take some community effort of getting out in that neighborhood and going door to door and, you know, things like that, being at the NetReach meetings as they host the community dinners and just sharing that information with them. So that's all part of working through this, but there are some dollars built in there for promotion.
I might just ask, Misty, we're using some different terms, food deserts. Can you
Uh-huh.
kind of talk
Yeah.
a little bit about that
Sure.
for the public?
I have a definition here. I'll read you just to make sure I say it correctly. A food desert is a geographic area where affordable and nutritious food is difficult to obtain, particularly for those without access to an automobile. And we actually have several here in Shawnee County. And when we did the sodium grant, what we ended up finding, the 4 gas stations that we worked with trying to promote access to fruits and vegetables and healthy food, the 4 that had the most significant amount of change were either within or right on the border of a food desert. And so they talked about how the majority of their clients use the gas station for staples like milk and bread, but also that they walk and bike to the gas station. And so we know that there's not the access to food in those areas. So that's kind of what we're aiming to address.
Thank you.
You're welcome.
What do you think of the Harvesters program and other programs like it?
Harvesters is great, and they actually have a very similar program to this cooking class that we're looking at doing when we've met with them and talked with them. The hard part about that is that they don't allow the kids to come to the cooking class. And so for our WIC families, that was part of the issue, and we want the kids to be involved if they can, because that helps build the family around that. And it's not the mom saying you need to, you know, we need to cook healthier. It's not the kid coming back from school and saying, Mom, we learned about, you know, fruits and vegetables today and we really don't eat very many of them. And letting the kids kind of be a part of that and learn how to cook with their parents. And so building that family structure. And the Harvesters program just doesn't have the capacity to allow the kids, but they do wonderful, wonderful things. They have the backpack program that helps kids on the weekends, and they do summer things, but
Okay.
so, yeah,
All right.
similar type thing. So,
Okay. Thank you
Thank
again,
you.
Misty.
The final thing we're going to talk about is the Food Policy Council. And when we were talking about the Community Health Improvement Plan and some of the activities and different opportunities that have presented themselves as a result of that work, the Food Policy Council is something that is one example of that. This is a very new concept to me, so as I speak about it, recognize I'm not an expert on this, but I wanted to be able to share with you some of the conversation that was going on in the community. Kansas State Research and Extension convened a meeting, and they had quite a few partners there that I had not interacted with before, producers, agriculture folks that we typically don't see within the health arena, but they're obviously very used to working with that group. But basically what they wanted to do was talk about Food Policy Council and whether or not in Shawnee County we could use one. Through those conversations, it was stated pretty clearly that they felt like the health agency should be the one leading this effort. And the only thing I could really commit to at the time when we had the meeting was sharing the information with our Heartland Healthy Neighborhood leadership team and also with the Board of Health. So I'm bringing this information forward for you to kind of start thinking about a food policy council and what that might mean to our community, and whether or not we want to participate actively or get engaged in this work. Basically, what food policy councils do is they bring together people to look at the food system. And so through really looking at ways to increase access to and consumption of those healthy fruits and vegetables and beverages. Obviously, that goes hand in hand with the work we do at the health agency. It goes hand in hand with the work with our community health improvement plan. So this is a way that communities are coming together to look holistically at the system to see how they can make changes that are going to make folks live better lives. You can see this is just kind of a representation of the types of partners that participate in this work. They usually want to have elected officials really being in the middle of the policy, the Food Policy Council. And that I think is the reason why they brought the health department or suggest the health department, because of our tie to the Board of Health and other elected officials. But obviously you can see there's a variety of people that come and bring their own expertise and knowledge to the system. And again, it goes right back to trying to make changes so that we can increase access for folks. Some of the things that food policy councils are doing or have done in other areas, really looking at getting those SNAP cards or EBT cards accepted at the farmers market. I mean, that's really big. That would be a really big positive change in our community. Community gardens, we have lots of community gardens going on, but do we really know across the board who's doing what and who's being able to access fruits and vegetables through that avenue? Grocery stores, trying to get grocery stores established in some of those food desert areas. One of the examples I read about was the Food Policy Council looking at zoning requirements and whether there's something that's barring a grocery store from cropping up in a neighborhood that could be changed through the Food Policy Council. Are there issues with people being able to get transportation to maybe a grocery store site that maybe we could look at the transportation routes? Just very, very different things that we probably don't think a whole lot about, or at least, we tend to get in our own siloed area and don't recognize the work and what others can bring to trying to make good solutions. But this is just a little bit of information on the Food Policy Council. I've got lots of information I can bring to you or send to you via email, so you can explore that as a possible direction for us if you're interested. But I'd be happy to try to answer any questions you may have related to the Food Policy Council. And I don't know if Misty or Craig, either one of you all have anything to add. Dr. Pizzino? Okay.
I might just ask local examples or regional examples. Does Lawrence have?
Lawrence has a food policy council, and it sounds like they've done some neat things. They actually brought one of the ladies from Lawrence to speak at the meeting we were at. I'm not real sure if K-State Research and Extension plans on bringing those partners together again. I will provide feedback from our HHN meetings, as well as any feedback that I receive from you all, so that we can decide on what we might want to do next.
Be good, be helpful.
Mm-hmm.
And any countywide, is Lawrence, is it Douglas County or just within the city limits of Lawrence?
Oh, I don't know that for
I don't
sure.
either. Lawrence Douglas County, so it is countywide. Okay, all right, good. Just different examples
Mhm.
might be helpful to
Okay.
just kind of know exactly what we might consider.
Well, this brings a conclusion to the formal presentation, and we'd be happy, any of us, to answer questions based on what you've heard so far, or if you want to provide any feedback for future meetings, we'd be happy to hear that as well.
Commissioner?
As always, very informative, and appreciate the time and effort that goes into this and the work that you do.
Thank you.
I think it's really important to have these conversations on a consistent basis, especially now that as a result of the safety net clinic or safety net clinic discussion and the fallout of that, if you will, of the possibility of the community health center and public health being having that distinction a little bit more. And I don't think the public understands that completely now. all of this will still continue,
Mhm.
you know, even though something maybe look different with the community health center. And I think just to reassure the public that this has always been going on, it
Mhm.
will continue as part of public health, community health, that we don't get that confused in the coming months.
Mhm.
Because just as I've been out talking with people, they're like, you know, the health department's gonna go away? No, you know, so I think it's
Sure.
good to have this on a consistent basis, even more importantly, in the coming year,
Thank you.
so.
Yeah, I couldn't agree more. And when Allison came to me, well, several months ago and
Mhm.
said, you know, you ought to have a public community health board meeting on a quarterly basis. We've got a story to tell, and we ought to do that. And
Mhm.
we are, and I think the fact that our media partners are here helping us tell our story
Mhm.
is a positive sign.
Absolutely.
And I'm very, very glad of that and appreciative. So
Thank you.
if there's nothing else,
Are there
we
any-
are,
Are there any public comments other than?
Okay.
all right. Thank you again,
Thank you.
everyone, and we are adjourned.
Thanks for taking notes. You're welcome.
Excuse me.
I looked it up, but the reason I remembered is because